Okay, so today we're going to talk about a topic that is very familiar to me, which is chronic constipation. If I had to put a percentage on there, I would say that 75% of my patients that come in here have check off chronic constipation all the time. So I have a assessment form. And it's like, do you have chronic constipation? Never, sometimes, a lot of time, all the time. 75% of them, all the time. That is a big deal. Chronic diarrhea is a big deal. Chronic diarrhea, you get like dehydrated and you lose electrolytes, but it's nothing like chronic constipation, because chronic constipation means you are not detoxing. So when I have somebody comes in here and they have chronic constipation, it's like the first thing I'm looking at to see what is it, what are the possibilities, how do we get those bowels to move, because if my patients aren't detoxing, they're not getting better. And toxins are big triggers for autoimmunity. They're big triggers for tissue-specific type of problems. It's a big deal. So what's chronic constipation caused by? Number one cause, by far, of chronic constipation is stress. Stress. And who's not stressed today, right? So, or who's not trying to make you stressed? And I'm not joking about that. It's been a big issue that we've observed in the past year, has created more depression, more anxiety. Past year, COVID. I'm referring to COVID, but you can throw the election on top of it and that whole thing. But the COVID, the fear, the this, the that, more people with chronic constipation and anxiety and depression than I've ever seen in the last 5 years, all put together. So stress basically paralyzes your stomach, pancreas, gallbladder, and intestines on purpose, okay? Because stress is a survival mechanism. There's a part in your brain called the amygdala. It's the fear center in your brain. When that fear center looks around, sees something it's not used to, sees something that it thinks is like dangerous to it, sees a guy standing over there who looks like he's going to attack you, it goes into action. It tells your body to change the physiology, send blood sugar to your muscles. It sends adrenaline to different areas. It sends epinephrine out there so you can breathe more. It puts you in a chemical situation so that you are stronger, faster, thinking more clearly, able to move quicker so that you can fight or flee, okay? Eating and pooping are not included in that. You don't need to eat or poop while you're fighting or fleeing. It's interesting how nature has figured that out. And so that's fine for 10 minutes, 15 minutes, 30 minutes, couple hours, okay? Maybe even a couple of days, okay? But it's not fine beyond that. Beyond that, you need to eat. Beyond that, you don't feel like eating, you eat, you don't digest, because it literally paralyzes your stomach's ability to make something called hydrochloric acid. It then paralyzes your gallbladder. Number one cause of gallbladders coming out, stress. Oh, I had stones and I had a load of stones and my gallbladder wasn't pumping. Yeah, because your gallbladder wasn't pumping for years because you've been in chronic stress, and now you're not processing the bile that goes through there and you make stones. And and I get it sometimes if it gets caught in the bile duct, but I mean that's what causes gallbladders to come out. Number one cause is stress. So then that you can just imagine that, and that stress also causes the peristaltis, the migrating motor complex. I'm beginning to see my patients asking me about the migrating motor complex, so that's getting out there now. Your bowels stop moving. That's what happens, okay? That paralyzes the peristaltis, the little movement that moves your feces along, and you get constipation. When you get constipation, it is a bad thing. And I had a lady come in here the other day and say, I didn't realize that you're supposed to go to the bathroom more than once a week. Like, okay, well, you eat 2 to 3 times a day. You should have a bowel movement pretty much for every time you eat. If you eat like a regular, if you eat like regular meals. And that's just the way it is. I mean, why would it not be that way? It would not be that way because there's something wrong. And when there's something wrong, you have toxins that back up in your system. They give you headaches. They make you lethargic. They make you feel like you're fatigued, and the toxin can get into your fat cells. If you're trying to lose weight, forget it. If you're stressed between the cortisol, the insulin, and you're not pooping, you're not going to lose weight. So it's a big deal. Way more than that. It goes way more than that. The second, as far as the importance of getting over your constipation, second most common cause of constipation is thyroid. And second most common cause. And basically, whether you have Hashimoto's or hypothyroid, both of them create an aspect of physiology that slows everything down. Stress paralyzes it. Thyroid slows it down. For those of you who have stress and Hashimoto's, guess what? This is why you have chronic constipation. And so, so basically it's the same thing. It's just that it slows everything down. It slows down the stomach. It slows down the bile. It slows down the liver. It slows down the gallbladder. It slows down the pancreas. And it doesn't. And not everybody's different. Some people it's one, and some people they go take Bragg's apple cider vinegar, and they start putting hydrochloric acid in their stomach, and the next thing you know, oh my God, my constipation is gone. That's what it is. And they go tell all their neighbors to drink apple cider vinegar, and they all go buy apple cider and drink it, and it doesn't work. Okay, because it's different for each person as to what part of the digestive chain is breaking down. But thyroid's number two, and then it causes all the same things I just got done talking about in stress. And then number three, I see for chronic constipation is small intestinal bacteria. Now look, I'm eliminating the fact that you may have pathological problems relative to your stomach or your gallbladder or something, or your gallbladder might be gone. That can do it. That can do it. Most people know that by the time they get here. So that's why I'm not getting into that very heavily. Most people know that if they have some sort of a pathology or a stricture in their intestines or something along those lines, that can create a constipation type of a situation. Or that they don't drink enough water, that can cause constipation. Those I think are more obvious. But the big one to me, the next big one to me is small intestinal bacterial overgrowth. And how do you get that? You can get it from eating like crap. You can get it from being stressed and having a thyroid problem too. Because in the end, what happens is whatever causes that imbalance on the inside of your intestines, like for example, the fact that having a thyroid that affects your digestive chain, having a stress response that affects your digestive chain, can alter the bacterial environment in your intestines, and that can lead to something called small intestinal bacterial overgrowth. If you have that, you can have irritable bowel, which you can have both constipation and diarrhea, but you can have constipation. From the small intestinal bacterial overgrowth. And how do you get that? Usually from the digestive chain breaking down, usually from you getting food sensitivities. It can be caused by chemical imbalances. It can be caused by drugs that you're taking that are non-steroidal inflammatories that you're taking every day that are damaging the inside of the lining of your intestines and your stomach. You can get it from taking these antacids, the omeprazoles of the world and the purple pills of the world, because they kill the hydrochloric acid in your stomach. They screw up your whole digestive chain. So they can take away your acidity, and the next thing you know, you got constipation. So it's an alternation somewhere in that it's your intestines, right? It's your stomach. It's got to be somewhere in the stomach, intestines, gallbladder, pancreas, and that's where kind of the medical model falls a little bit short on that. I mean, it's like, okay, go take milk and magnesia, or give you some sort of a medication that's going to make that migrating motor system move somewhere there. So it's kind of like Band-Aid type of a thing. I mean, believe me, if you don't know how to get rid of your constipation, and that's the way you got to do it, do it. You want to be pooping. You do not want to be walking around with constipation, because if you have aches and pains and brain fog and migraines and all that kind of stuff, there's a good chance it's part of the problem. And so constipation is a big, 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 big deal And I think that kind of summarizes it without, again, my Cliff Notes version, without getting into everything. But I think that would give you good direction as to where to start to look relative to what's causing my constipation.